Good morning and welcome to the Study Does It webinar. Today we will discuss balance, the balance system, and methods to improve your balance and help prevent falls. I'd like to share my screen with you in just one moment. My name is Valerie Rucker and I am a physical therapist at My name is Dr. Valerie Rucker, and I am a physical therapist at Capital Physical Therapy here in Washington, D.C. So what is balance? There are 3 parts to your balance system, and all of these parts interact with areas in your brain to create motor outputs, which result in your balance. You've got your vision, your somatosensory, which is your sensation, and your vestibular, which is your inner ear. The vestibular system can be disrupted by disorders such as BPPV or vestibular migraine. The somatosensory system can be disrupted by diseases and disorders such as diabetic foot neuropathy or stroke. Visual changes may occur due to diseases and disorders such as glaucoma, stroke, or normal aging. So why do I fall? Well, you're really not alone. According to the CDC, over 1 in 4 older adults ages 65 and up falls each year. That is not only costly to the healthcare system, but also affects so many individuals. Reasons or risk factors for falling could include weakness, decreased amount of vitamin D, poor balance or walking, certain medications, vision issues, foot pain, or your home environment. For the purposes of physical therapy, we focus on weakness and poor balance or walking, as well as the home environment. How can you prevent falls? Well, we talked about the home environment. In the home, you are encouraged to have well-lit areas. Add additional light like hall lights, lamps, or bathroom lights. Let's get rid of those area rugs, right? Those are things that we can easily stumble upon if they lift up and our foot gets caught on them. I stumble over uneven sidewalks outside, right? So that's something that I can't control, but in your home, you can control these things. So try to get things repaired like uneven surfaces in the home. Bathtubs are slippery and wet, and so you want to take precaution by maybe adding some grab bars in the bathroom if need be. Handrails are no good if they are wobbly, so think about that sensation and the information that that's sending to your brain. Stairs are supposed to be sturdy, and if a rail is wobbly, your brain can calculate that and try to adjust based on previous experiences and what it thinks it should happen. It can get thrown off if it's not prepared for something like a wobbly rail, so make sure you're securing those handrails on your stairs. Another way to prevent falls is by training the balance system. If 1 or 2 of the systems are down, then you have to compensate. So let's look at some balance exercises which focus on improving all 3. If you do have a fall, remember to first breathe. Let's go through how to maybe get ourselves up off of the floor if we do have a fall that results in us being on the ground. First of all, after you breathe, please check your body for injuries. If there are injuries present, maybe a broken bone or a laceration or cut, please call 911 with your nearest phone. If not, then we'll proceed to recover from our fall. First, assume hands and knees position, like the top right picture. Then crawl to your nearest or sturdy chair or couch. You want to make sure that the chair is sturdy so that you're not toppling over with the chair again. So once you crawl to the nearest sturdy chair or couch, you'll plant the hands on the surface, similar to the bottom right picture. After planting your hands on the surface, slide one foot in front of the opposite knee. Then press through your hands and the front leg. After that, stand up. You did it. Now, this method is really helpful for individuals who have pretty good upper body strength and pretty good thigh strength or quad strength. If that's not you, please do call 911 to help assist. Now we'll talk about those balance exercises, and we'll start off with the ones for beginners. Standing marches are wonderful for balance. In order to do this safely, maybe you place a chair in front of you in order to help maintain your balance. You can tap your fingers on the chair or keep your fingers there on the chair just for increased balance. Another way to improve the balance system is placing your feet together. Remember that somatosensory system that we talked about. The sensation that comes from your feet being wide apart versus your feet being in a narrow stance is different. Your body is taking in the information differently. So placing your feet together can cause an increased challenge in your balance because you're decreasing that surface area that you're standing on. In order to challenge this a little bit more, instead of having your eyes open, maybe your eyes are closed. Another option is standing hip extension. With this, it's similar to this picture at the bottom left of the picture block here on the right of your screen. And what that is you're going to stand on one leg and then kick one leg behind you. Not only is that strengthening both hips, but it's also increasing the balance challenge by having you stand on one foot at a time. Similar to the picture, you're more than welcome to place a chair right in front of you in order to increase the likelihood of keeping your balance. Also, sit-to-stands are a wonderful way to try to improve the balance system. Doing this with no hands, meaning no hands on your thighs, no hands on the seating surface, can also increase the balance challenge. Making it a little bit more difficult, one might place a pillow or a piece of foam up under the feet in order to have a little bit of challenge to that somatosensory system. Another challenge would be to do this with eyes closed, but you want to make sure that that chair is right behind you. I really like Tai Chi and yoga for older adults for the group aspect as well as the physical benefits. In both of these activities, you're really challenged to have a strong core and good balance. Next, we'll talk about balance exercises for maybe the more advanced individual. All of these, single leg deadlifts, curtsy lunge, single leg squat, Bosu squats, tree pose, and yoga levels 1.5 to 2 are all methods for an individual who has a more advanced balance system. Any of these activities can be progressed or regressed depending on what is necessary. You can do the deadlifts with 2 legs on the ground instead of just 1 leg, or to challenge you, on the opposite end, you can place a foam up under your foot. With the curtsy lunge, you can hold on to the wall, or to increase that balance challenge, you can do the curtsy lunge on an elevated surface like a mat table or a stool. You can also, with the Bosu, flip it over onto the flat side or maintain it on the ball side, whichever works best for you. You can even try a single leg Bosu squat. That is probably entirely too challenging for me. But for some, it is just right. So you want to find the appropriate challenge for you. The way that you know that it's an appropriate challenge is, am I able to hold this position for 30 seconds easily if it's a static position, or is that entirely too challenging for me? Can I only hold it for about 6 seconds? You want to ask yourself these questions, as well as, am I really toppling and stumbling? We don't really want that at all. While we hope that you have great stepping strategies to recover your fall, we really hope that these balance challenges are simply that, just challenges, not impossible. Sometimes we may experience dizziness in standing or feel off balance from reaching or lifting items. Some tips with reaching and lifting are: relax the knees, give a slight bend in the knees. Please activate those core muscles by drawing the belly button in and up. Avoid being on your toes. So if you're reaching for something, try grabbing a step stool or something very sturdy to step on to reach instead of being on your tiptoes. Bring that object close to your center. With a tight core and the object close to your center, your body is going to be able to stabilize itself, because all of the majority of the weight is in the middle or the center. Remember to breathe. If you're not breathing, you're getting dizzy, you're getting lightheaded, and we don't want you falling. Rely on those legs. Those are the strongest muscles in your body. The ones in your hips, the ones in your thighs, they're the biggest muscles. So really rely on those legs and less of your back. Check the weight of the object. A good way to do this is just push it around. You can push it with your toes, or if it's possible, you can push it with your hands. But make sure you're checking the weight of the object before you go to lift it. Finally, when do you seek medical profession or medical help? Well, notify a PCP or neurologist if you find that you are having symptoms of vertigo or dizziness. Notify your PCP or endocrinologist if you find that you are having decreased sensation. This could be a sign of diabetic neuropathy, and PT can help with that, just as PT can help with vertigo. Notify your PCP or neurologist if you're experiencing vision changes. Vision changes may be age-related, but they can also be something else. Occupational therapy can help with this, as well as physical therapy, which would help work on the systems that affect your balance, like we talked about. So remember, those 3 balance systems are your vestibular, your inner ear, your somatosensory, your sensation, and your vision. Thank you so much for joining us for this brief webinar on balance. Please see these references at your own time. If you would like more help with your balance, please contact Capital Physical Therapy, located in Washington, D.C. Information is below the video. Check it out.